Well, although winter is holding on, it is spring on the calendar, and we know the warmer weather is just around the corner. And with warmer weather, soon the trees and flowers will be budding, and that means if you're like me, seasonal allergies will have us reaching for the tissue boxes, the nasal spray, the allergy medicine, whatever, everything, right? Well, Dr. Jay Prochnow, an allergist with IU Health Arnett, joins us this morning to talk more about seasonal allergies and how we might be able to get some relief. Thank you so much for being here. We appreciate it.
It's good to be here.
Well, my first question is, I've always heard that, in Indiana, it seems like our allergies are the worst. Or a lot of people in the Midwest are prone to allergies. Is that true? And if so, why is that?
Yeah, I think it's bad everywhere.
Okay.
What's unique about the Midwest and what's unique about, I think, Indiana is we're a fairly agricultural state, so lots of mold spores and things like that here. And I think the Midwest is probably ragweed central too. So I think in the late summer and fall, I think the Midwest is the worst for ragweed.
Yeah, that's one I know I'm prone to. If a patient is looking for some relief, maybe some over-the-counter relief, I hear rumors about maybe you should switch brands every once in a while. Is that a good idea? Is there anything out there on the market that you recommend?
Yeah, a lot of patients do say that that some meds will wear off after a while. They seem to stop working. I think the over-the-counter remedies that seem to be fairly effective are the newer antihistamines like Zyrtec or Allegra or Claritin. I like Allegra because it's non-sedating, and patients can buy generics of those over-the-counter, and usually they get pretty good relief with those.
Now, at what point should a patient see the doctor about? What point do your allergies become so severe that you need some extra help?
Yeah, I think if you're not responding to those over-the-counter medications, it makes a lot of sense to see a doctor for your allergies. Some of the prescription nasal sprays actually tend to work better than the over-the-counter remedies do, so those can always be prescribed.
You mentioned some medicines like nasal sprays. What other treatment options are there for allergy
Yeah,
sufferers?
I would say there's 3 treatment options for patients with allergies. There's avoidance, which obviously when it comes to seasonal pollens can be very difficult.
Yeah.
There's also medications such as antihistamines or nasal sprays. I don't recommend the over-the-counter nasal sprays because those can sometimes cause more problems with a rebound nasal congestion and things like that. And then finally, there's allergy shots. I tell patients that allergy shots work the best. Usually, I'll quote patients a 90% reduction in nasal symptoms with allergy shots, compared to 60% with a medicated nasal spray like Flonase or Nasonex, and then more like 30% with the over-the-counter antihistamines.
So lots of options out there, and really, if you've been struggling with allergies for a long time, just not getting any relief, that's probably the time to go see your doctor.
Sure,
then.
absolutely.
Well, thank you, Dr. Prochnow, for being here this morning and
good to be
answering
here.
our questions. We appreciate it.
Not a problem.